Alberta Health Minister Stephen Mandel announced Wednesday the creation of 300 restorative care beds in Edmonton and Calgary.
As you recall, last September, the Premier set out a plan to help reduce the pressures on acute care beds. The plan was simple: convert and/or build continuing care facilities to a long-term care standard. The plan was to create 750 units, of which 466 be available ASAP. We've now opened 303 of those 466. We are delivering on our commitment of last fall, but the reality is we need to do more. What we found is that seniors are spending too much time in hospitals awaiting evaluation and placement. In order to improve their opportunity for effective rehabilitation, we're establishing 2 centers, maybe more later, but 2 centers now. One in Calgary with about 186 beds and one in Edmonton for 125 beds. These facilities will be led by multidisciplinary teams of healthcare professionals who will work towards ensuring that patients are placed in the most appropriate setting, whether it be long-term care, supportive living, or we hope many back in their homes.
Along with Alberta Health Services President Vicky Kaminsky, Mandel announced that emergency departments and hospitals in Calgary and Edmonton will receive renovations. Hospitals include the Peter Lougheed Centre and the South Health Campus in Calgary, as well as the Misericordia, Grey Nuns, and Royal Alexandra in Edmonton.
If we're looking at a system as big as AHS, there are ways for us to get efficiencies and economies of scale that we haven't necessarily brought to the forefront over the last 8 years. So, for example, something as simple as a print strategy. Who has printers? How much paper do we use? What do we print? Do we do it in color or do we do it in black and white? And that sounds perhaps small, but when we looked at our print strategy, if we were able to implement a standard right across AHS, we're talking millions of dollars of savings. So those are the kinds of things that we're going to be focusing on as we move forward. It is not about cutting frontline service. It is not about cutting frontline workers. It's not about reducing access to care.
Funding for the renovations for emergency departments are set to total up to $60 million, and that funding is said to come from efficiencies in the government. For the Edmonton Sun, I'm Trevor Robb.